All right, what's up, everybody? Happy Sunday. It's a beautiful, beautiful day, as I always say, here in South Florida. Hoping you guys had a great day so far. And then tomorrow is another a day to start off the week for work. But today we have a very interesting interview. I have a special guest today, but I will introduce her. Let me just read a little bit about her before I bring her on. So we have Dr. Monique Ruberu, and she runs the Natural Women's Health Practice outside of Philadelphia, Pennsylvania. They are holistic gynecology and fertility practice dedicated to uncovering the root cause of medical issues. She's also a proud wife, mother, Catholic, and a strong pro-life OBGYN advocate. She's also a little bit of a background, just a little bit more. She's a board certified OBGYN and creating fertility care medical consultant. She has been a NAPRO technology medical consultant in 2015. She's a pro-life advocate, author, and public speaker. She's passionate about providing women with an alternative to what they experience in traditional allopathic practices. She has no desire to cover up the symptoms with band-aids like contraceptives, but to help restore your health by examining the root cause. In her fertility work, she never refers for IVF, and she believes that the term unexplained infertility is a lie, and we will be talking about that as well. Good afternoon. How are you?
I'm great. I'm great. Good to be with you.
Same here. First of all, I just want to thank you in advance for everything that you do in the line of work. I discovered you like 3 months ago on Lila Rose's channel, and I'm like, oh my goodness, this is good. Let me see if I reach out to her and she responds. You just never know. And you responded like right away. So that's
Awesome.
awesome. I want to thank you in advance.
Yeah, no problem. Always excited about getting the word out about this information and helping more women to try and alter their health and try and get to the root cause of their problems. So, makes
Right,
sense.
right. That's awesome. And you're actually not too far from me in my home state, New Jersey.
Oh, cool beans. Yeah.
I was born and raised in New Jersey. Came here 8 years ago to South Florida to Miami. So this is where everything has been. Married, two kids, two under two, as I mentioned to you offline. A lot of work, a lot of hard work.
Lots of blessings.
Right, right. So, but yes, I'm just glad to have you here. So we're just gonna get started. I know I already mentioned a little bit about what you do. Can you just tell me a little bit about your background as far as culturally, your family, your parents, any siblings? Where did you grow up? What's your nationality? All that good stuff.
Absolutely. I was born in Canada, and my ethnic background, I'm Sri Lankan. So Sri Lanka, small island off the southern coast of India. Its own separate, beautiful, amazing little country. And we grew up in Canada and then moved to the States and spent most of my life in the States, and then went back to Sri Lanka for a while and have very strong roots back home in Sri Lanka as well. And ultimately ended up in this area on the East Coast because I came here for residency, for my OBGYN residency, and then just kind of stayed on. So have lived in Philly for a really long time at this point. But my family's kind of dispersed throughout the world. We have extended family all over the place, and so lots of places to visit. I'm a mom of five, so I have two
Wow.
saints in heaven. I have three here, and happily married to an amazing man. And I am proud to be Catholic and take my faith very seriously. And that's, I think, a large part of why I practice the way I do, because I believe that God created each of us perfectly and to heal. And we oftentimes mess up the gift of our bodies that He's given us.
Mm,
And so my goal is to help people to kind of restore the perfection that He created. So,
yeah, that's awesome. So I want to talk a little bit about that in the faith because I mean, because of that is like you said, what you do and what you believe and how you practice. So just talk to me a little about your faith. How did that come about? You know, was it always instilled in you by your family when you were growing up, or is it something that happened in your adult years?
So my family has always been Catholic. My parents were always church going Catholics. We never missed a Sunday mass. I personally was probably more of a cafeteria Catholic growing up. I didn't really have a personal relationship with Jesus or Mary. I didn't feel like connected. Like, I mean, anytime something bad happened, I would run to them and I'd like, please, please, please help me. And they'd always be there. They would always come through. But it was really only probably about 10 years into my marriage. My marriage was on the brink of divorce, and stepped in and brought people into my life that completely healed my marriage and saved my kids from being kids of a divorced family. And that for me was the beginning of my entry into the pro-life movement, because I wanted to do something outside of my box to kind of pay him back in a sense. And that's how I ended up going to an abortion center to pray outside, which led to pretty much everything else that I do now.
Wow.
So, yeah.
That's awesome. That's awesome. Yeah, I mean, everything starts from God.
Absolutely.
Everything starts from God. Anything else is just like you missed everything. That's awesome. So you run a natural women's health, facility, correct?
Correct.
So, and this is obviously, as I ask you these questions, I'm learning because obviously this is not my area and know much about the, infertility and all that. I just know basic stuff, but it's
Sure.
also good for me to know. And then for those that are watching, and then as we get into later on with the topic of abortion and the infertility issues, that's a very sensitive topic. And what a way to talk about this 2 days away from the election, right?
Mhm. Yeah,
And
huge,
it's yeah.
very important
So
topic.
yeah, so
Yeah,
it seems like this has been the from what I see, I don't know, you can say it. For what I can see, it seems like this is really the main topic in this presidential election. The reproductive rights, basic what they call it, basic freedom rights for women. All that. It seems like that's the main thing, in my
yeah.
opinion.
So, unfortunately, I feel like so there's so much in this, right? As far as the election is concerned, one way or another, somebody is going to come into power. One way or another, we're going to keep walking forward and do what we do every single day. And it's really important for all of us to just have peace and to know that God is in control of everything, no matter what happens, no matter who comes into power. And there is no perfect candidate by any means. Like, nobody is God. And so every single person who comes up as a candidate for presidency or any other elected official will always be a human being. They can always make mistakes. They can always have faults, but they can also always be converted and be redeemed through Jesus Christ. And so there's so much hope in all of this. And people can change their mind on their stances. People can, Saul to Paul can happen anytime through the grace of God. That being said, I feel like, especially when it comes to the abortion topic in this pre-election time, I feel like there is a lot of misinformation that has been pushed forward. Like, there's a lot of fear tactics trying to convince people that they have to vote one way or another simply because if they have an ectopic pregnancy, they're not going to be able to get medical care. Or if they have a miscarriage, they won't be able to get medical care. It's complete lies. Because as a physician, I can tell you there is no physician out there who would class abortion in the same realm as treating a miscarriage with a DNC or treating an ectopic pregnancy or treating a woman who has an infected uterus in the midst of a pregnancy. Those three things are completely different from an elective abortion where a woman has a living child her life is not at risk, and she desires to terminate that pregnancy and the life of that child. That is what many of the laws that have been put in place in places like Georgia and Texas, the heartbeat laws, that is what they are trying to prevent, those elective terminations of pregnancy, the barbaric procedures that shred these babies to bits and throw them in the trash. When who have like severe medical problems, which the baby being in place would put their life at risk. That is the whole reason we have an entire population of OBGYN physicians who are called maternal fetal medicine doctors. Their job, they have specifically been trained to take care of high-risk pregnancies. And their job is to try and get that mom and that baby as far along as possible while both mom and baby are safe. And if they reach a point where, okay, we can't do this anymore, your heart isn't tolerating it, or your kidneys aren't tolerating it, or whatever, the risk is too high, then they can decide to deliver early. It's completely different from first killing the baby and ripping it to shreds and laying it in the trash. You deliver early means you can C-section delivery, or you can induce a vaginal delivery, and that baby may not survive if it's under 20 weeks or 22 weeks. But that baby can be held, that baby can be mourned, that baby can be buried, that baby can be honored. That mother doesn't have to go through the trauma of, I killed my child and I didn't do everything to save my child. That is a complete difference from, oh, your child has trisomy 18 and your child likely will not survive, which is also a lie, because there are many children out there who have trisomy 18 who have been living many, many years and bring their family so much joy. And yes, they have medically complicated cases, but they're a person in their entire family. And so,
yeah.
Oftentimes people are told, oh, your child has Down syndrome, your child has trisomy 18, your child has this, your child has that. You should have an abortion because this child will not survive. Not that the child is putting your life in risk, not that there's anything going on that would, cause harm to you in any way, but you should terminate. And so then they either injure the baby's heart and give the baby a heart attack so the baby dies, or they'll just go in and rip off leg by leg, limb by limb, and throw that baby in the trash. And that's what happens. And it's really sad. But most people don't have an understanding, number one, of how abortions happen. They have been sold the lie that abortions are a gentle evacuation of the uterus. But if they go to live action, Lila Rose has provided the most amazing little cartoon videos that have been put together by former abortionists who will walk you through all the instruments that are used and exactly how it's done. And people will realize, if they watch that, they'll realize how barbaric these procedures truly are. And once people see that, they understand that, oh my gosh, okay, an abortion really isn't something that is just like, it's a torturous procedure that is very upsetting to watch and very upsetting to hear about. And I feel like when people are being told that if you have a miscarriage and you're bleeding out, that nobody will take care of you because of an abortion law, that's a complete lie. And any place where that has happened, that is not the law that is at fault. That is that physician who failed to respond, because any woman who is bleeding out, automatically she should have been in that hospital, IV in her arm, with blood products ordered, with IV fluids running, monitoring her cervix, seeing if she was delivering, setting up the OR for a DNC procedure. If the baby's heart was still beating, seeing, is there any way that this pregnancy could possibly be saved? Or, is she having an imminent delivery? Is she showing any signs of infection? Like, those are the things that they should be doing. Not let her sit out in the parking lot bleeding in her car, obviously, right? any hospital or physician is knowingly allowing that to happen, that's their fault, right? Any hospital that identifies an ectopic pregnancy in a woman and sends her out the door without evaluating her and treating her, that's their fault. If you read the laws, they say in there, this is what spontaneous abortion is, which is a miscarriage. This is what an ectopic pregnancy is. Neither of these are abortions. This law does not compromise the care having to do with these things. So you can't blame the law if people are misinterpreting the law or people are spreading lies about what the law means. Go read the law. Go read the law and see what it says. So.
Yeah, and that's unfortunate, and you are right. I mean, the law says what it said, but unfortunately, there will be people that will go over the law and just, do whatever it is that they want to do, or not fulfill the duty of that law for whatever reason, and it's crazy because so lately I've been posting more videos, from Lila Rose and some of your videos and whatnot, and I just been getting chewed up by other, women. And I think a faulty argument, faulty logic that I always hear is, you're a man, you should not have a say when it comes to this. And I just think
you have created,
right.
Like, if it wasn't for a man, that baby would not be alive. Fathers are equally responsible for the lives of their children as are the mothers. Like, to tell someone that you can create a child, but you don't have any say in the well-being of that child is ridiculous. Like, and that's why it is so important that people really think about sexual integrity. Right? Because if you are having sex with somebody who does not share your views, this is exactly what can happen. Because they're right. Men have been completely castrated in this topic. They are told that, I have seen time and time again outside of abortion centers, fathers literally crumpled on the ground, sobbing and crying because their girlfriend is in there aborting their child and they can't do a thing about it. Nothing. So men, choose your partners very well. Get to know them and don't have them until you get married to them and you know that they are not going to abort your children. I mean, it's totally ridiculous. All these guys like having sex with their girlfriends and then their girl gets pregnant. And guys like, oh, yay, we're pregnant. We're going to have a baby. And the girl's like, no, we are not going to have, I'm going to have an abortion. I don't know what you're going to do. Wow. And pay for it.
Yeah. That's just unfortunate. And the other thing I tell people when they make that argument against me or just in general is like, number one, this is a moral issue. I don't need, this has nothing to do with gender. I don't need to be a female or a male to tell you that it's wrong. God, the word of God says it. You know what I'm saying? It's not about gender.
Thou shalt not kill. It's very clear.
Exactly. So whether you're male or female, you have a right to share and say what's right or wrong according to God's word. It has nothing to do with gender.
Absolutely.
And exactly.
And at the end of the day, if you don't stand up and say the truth, when you die, you're going to have to face Jesus. And then he's going to say, why didn't you protect children? So keep at it, because any guy that like says, oh, it's a woman's choice, I have no say in this. Yeah. One day you're going to get the question.
Right. And then another thing too that really like boggles my mind, and I don't know if it is like this for every state in America, but what if abortion is not murder? Why is it considered double homicide when you kill a pregnant woman?
That's a great question.
You know what I'm saying?
The laws are so contradictory, and what people believe and say, it's very confusing, because that's a very good point. And absolutely it is. When you end the life of a human being, I don't know what you can call it if you don't call it killing a human being. And what is killing a human being? Like,
Yeah, yeah, yeah,
so.
yeah. And there's so many, and you know what it is? The enemy is so well. He thinks he's slick. The enemy thinks he's so slick because he's always coming up with different objections that try to disprove that this is not murder or killing a baby. You know,
You
like
know,
an argument that I hear a lot too is, oh, a baby is the fetus, right? They'll say the fetus is not human until they have personhood. Like,
now that personhood argument, all cap, it's ridiculous. So you can only determine what a thing is based on what its parents are. If your mother is human and your father is human, then you are human embryo, and then you become a human fetus, and then you become a human. Like those terms, embryo, fetus, neonate, toddler, teenager, those are just markers for time. But the smallest human being is still a human being. So it has nothing to do with personhood, because what is personhood? You can take care of yourself. Toddlers can't take care of themselves. Babies can't take care of themselves. Are
right.
they not people? So, like, it's this argument. The thing is, arguing for pro-life is pretty easy because it's all true. There's like, we're not lying about anything. The hard
Right.
part is actually defending abortion, which is a barbaric, brutal dismemberment of living human beings. Like, how can you, I don't know how you can defend it and argue for it and think that you're going to win. It just doesn't
Right.
happen.
Right. Yeah, it's difficult. Like I've seen videos from former abortionists. You know, they explain the procedure and they show you the instrument what they use to abort the. I'm like, oh my goodness! Like I don't know how can somebody just look at that and and it's either they're just totally depraved or they just really want to ignore the truth.
No, I think the thing is, most people who are defending abortion have been either they themselves have chosen abortion, or they have bought the lie that somebody needs abortion because of some crazy scenario. And any of those three scenarios, once you have chosen abortion, you have one of two choices. Either you can repent for what you have done, and you can ask Jesus for forgiveness, and you can be filled with a peace and a calm, or you can defend what you have done. And in order to defend what you have done, you have to fight for that cause, because you have to make it right. And you have to go out there and stand in front of an abortion center and act like it's a woman's right and that you're helping women, because otherwise you're going to break down because you feel so bad about the fact that you ended the life of your own child.
Right. That's deep. That's deep. Man, there's so much to say about that.
Yeah.
But we're gonna. I wanna. Mhm. Go ahead.
One more thing, I honestly feel like men who support abortion, there's a difference. There are men who have had family members who have chosen abortion, and they feel like they have to defend the dignity of those family members and act like those family members or their girlfriend or whatever is still like made the right choice.
Yeah.
Or they have guilt about their involvement in that abortion. They paid for the abortion, they forced someone to have an abortion, or they're just scum and they like want to use women. And the easiest way to get away with using women is to have abortion as the way to clean up the dirty.
Wow. And not take responsibility for their
And not
actions.
take responsibility for any of the children that they have fathered.
That's sad, and it sucks because it also goes both ways because there are a lot of men, especially teenagers or just men or boys or just men in general, where they get the girl pregnant and they leave, and then that it leaves the woman in a position. I'm like, crap, like what now, and obviously they still have to make a choice. They're gonna either abort or they're gonna have the child no matter what. But it gets me frustrated because my line of work, I work with middle school and high school students. for in a nonprofit organization, many different schools in South Florida, and we focus on the importance of making healthy decisions with any type of relationship, whether it's romantic, whether it's with their friends, family, with the money, with themselves, and we do talk a lot about like relationship red flags. We talk a lot about friendship, love, and dating, and we always talk about being intentional, getting to know that person before moving too fast. Do not awaken love before it's time, as the Bible says. Because if not, like you said, you're gonna run into things that you never knew about that person, and all of a sudden you want that baby, but she doesn't. But you did not know that because you did not take your time in being intentional, getting to know them and see what their values are and what their beliefs are, and I see it all the time, and the conversation that I have with my middle school and high school students, like it's just sad. And sometimes I ask, where are the parents? And if it's not the parents, it's TikTok is raising this generation. They're learning everything from TikTok. They're learning everything from, these music videos and the lyrics, and it's just ruining them. So it goes both ways, but you have to be intentional and getting to know that person before moving forward, before, taking that step of being sexually active, and obviously, as our belief, get married before you do any of that. you know?
Absolutely. I always tell kids, I talk to the girls and the guys in the same way. I'm like, you are so precious. God created you so perfectly, and you are so deserving of honor and respect, and you don't deserve to be used by someone for their sexual pleasure. So the best way to understand if a person is with you because they love your mind, heart, and soul is to stay as far away from sex as
Mm,
possible. And every moment that you're dating someone is truly an opportunity to see, does this person match
mm,
what I'm looking for in my future spouse and the future parent to my children? Like, if it's a girl, is this guy going to be an amazing head of the household? Is he going to be someone who can protect our family? Can someone
right.
who can provide for our family? Somebody who has like the strength and the courage to stand up. If it's a guy, is this going to be an amazing mother to my children? Will she love my mother the way that I love my mother? Will she protect our whole family? Will she care for our whole family? And those are things that, like, every person should have all the attributes they're looking for in life and all of the things that they are trying to avoid. And then they should have conversations around those things to be able to decipher, does this person have this attribute? Like, is this person a cheater or not? Does
Mm,
this person like pornography or not? Is this person somebody who has a gambling problem, an addiction problem? What is their family mental history? Like, were they
mm,
abused? Like, all of these things, because those things tend to show up. Like,
yeah.
unless they're resolved before you get married, that you're going to carry all that into your marriage. So
Mm,
I always tell people, save your next kiss on your lips for your wedding day. If you do that, if you don't make out with someone, you're not going to be tempted to have sex with them. And if you
right.
stop it right there, then every conversation you have with that person can be a meaningful, deep conversation where you actually get these questions answered. And when you do, you will very quickly understand, does this person match up with the kind of person I want to get married to? And if not, move on. Like,
Mm,
why let that person occupy that space? Because the right person is going to be walking by, and when they see that space occupied, they're not going to want to break up a relationship. So you might be losing your chance to be with that perfect person
mm,
that created for you just because you can't let go of someone that you know isn't good for you.
mm. That's deep. That's deep. I love it. I love it. So I want to switch it up a little bit, but I do want to go back to this topic, because
Yeah.
I do want to talk more about what you do in your practice. Dealing with infertility, postpartum depression, which is a very big thing, and me and you, we have spoken a little bit about it offline and whatnot. But can you talk to me about menstrual cycle? So there
Yeah.
are women who has it real bad, like the pain is so bad, but then there are others who is not as painful. Why? I guess why is that? And is there a way? Is there a way for periods not to be so painful?
Yeah, because normal periods are not painful.
Mm.
That's what it comes down to. When there is pain with a period, when there is severe pain leading up to a period, severe pain during ovulation, there's something wrong. And that is not something that should be shut down with a birth control pill to cover up symptoms. You need to get to the root and understand why it's happening so that then you can address that underlying issue and solve it. So typically people have severe pain with their periods. It's because either they're bleeding really heavily and their uterus is trying to contract to get all that blood out, or it's because they have endometriosis. Endometriosis is when little bits of the inner lining of the uterus are implanting outside of the uterus, and it causes a lot of inflammation. But the root cause of both of those things is typically crazy high estrogen levels. And it doesn't mean that those women are estrogen producers, that they're making tons of estrogen at all, unless they're an obese woman. And the fat cells, the abundance of fat on your body can produce tons of estrogen, which will increase your risk for this. But typically it's because women in that scenario have really bad gut health. And these are women who are drinking tons of coffee or caffeine, and they're sucking back all the water from their gut because the caffeine's a diuretic. It makes them lose their water and they end up dehydrated. So their body's looking for water, sucks it back from the gut, and they're sucking back all toxins that their liver has packaged up and put into the gut to get out of their system. So they can't get rid of these toxins. So they get a buildup of estrogen in their system, and that estrogen impacts the way their body works. And it thickens the lining, it causes fibroids to grow, it causes polyps to grow in the uterus. All those things make the bleeding very heavy. It enhances the endometriosis growth. So it's all a matter of cleaning up your gut, cleaning up your diet, getting rid of caffeine. There's tons of natural supplements you can use to try and decrease that crazy bleeding. And you should always check and see, like, do you have a lack of progesterone? And that sometimes will cause you to have really frequent cycles, so that you like go from bleeding to a day off to PMS to bleeding to a day off to PMS. So you're always feeling miserable. But all of that can be solved. You just have to work with someone who knows when to test, how to test, what to test, and then how to address it. But when it comes to the postpartum depression is just a continuum of PMS. People that have low progesterone typically will have tail end brown bleeding at the end of their periods. They'll have either short or long cycles, depending on if they also have PCOS, but they'll have PMS symptoms right before their periods. Everybody thinks PMS is normal. It's not. It's a sign of progesterone deficiency. So when you have PMS, people will have headaches, or they'll have anxiety or depression or rage or irritability. They'll have swelling in their legs. They'll have breast tenderness. It's like all of these different symptoms. So you have to check for estrogen and progesterone levels after you ovulate and compare those to what's normal. So you can identify, like, is the estrogen high? Is the progesterone low? What's going on? So that you can remedy it. But when you put back the right amount of progesterone, whether it be seeds or compounded progesterone or progesterone, micronized progesterone from the right pharmacy, people do much better and they feel much better. But people who have PMS, after having their babies, that progesterone is right down again. And so they experience postpartum depression. And so the postpartum depression can typically be solved within 24 hours with a shot of progesterone. And you can do ongoing progesterone just at bedtime when they're going to sleep. It does make you sleepy, but it definitely helps.
Yeah. And is that pretty much what if I say it correctly, the NAPRO technology part of it?
Yeah, so NAPRO technology is really, it was created by Dr. Hilgers, and he was a medical student when Pope Paul VI came out with Humanae Vitae. And when Humanae Vitae came out, it was basically an encyclical that kind of challenged men and women of science and men and women of the world to find a way besides contraceptives, because contraceptives at that time were out. And this man was brilliant. He realized that contraceptives would be tied to the breaking down of marriages and abortion and all of these different things, which is true. Since the onset of contraceptives, that was kind of like a reason for people to be like, oh, now no one will know what I'm doing, so let me participate in all of these other activities outside of my marriage. And it led to a lot of like division in husbands and wives, a lot of issues. But on the medical side of things, contraceptives completely shut down the natural plan that God created in your body. It's like fighting against the natural mechanisms, trying to shut things down. And when you try and shut systems down in the body fights back. And it creates like an abundance of estrogen and more estrogen dominance.
Yeah.
And so NAPER technology was an attempt to use natural family planning methods to every GYN issue without the use of contraceptives, to address infertility without the use of IVF. And it was extremely successful because he was able to correlate these natural family planning charts so that you could identify when somebody was ovulating, and then you would know when exactly to test for hormones. Versus in a typical gynecology office, they'll be like, oh, you want to check your hormones? Okay, we'll come on day 21 of the cycle. Well, day 21 doesn't mean a darn thing, because somebody could be ovulating day 14, another person could be ovulating on day 22. So if you check a day 21 lab and you don't know where the person's ovulated, you have no way of knowing what the lab means. You know what I mean? Right. So when you check a lab instead in association with where you're ovulating, you always know what normal is, and you can compare those labs to what normal is, so you can say if it's normal or abnormal, and then you respond to it. So it just makes so much more sense. But it helped people to understand what all the bodies mean. Like what exactly does your bleeding mean? What exactly does your mucus mean? What does a lack of mucus mean? What does abundance of mucus mean? But I feel like even with NAPER technology, you need to keep going deeper, because that literally just kind of sets the stage for what you're looking for. But then the question is, okay, I see there's an abundance of mucus and you obviously have estrogen dominance. Where is that coming from? And that's when you get down to you've got to like cleanse your bodies. So cleaning up your diet and making sure you're drinking enough water, making sure you have enough salt in your diet, or you have enough iodine for your thyroid to work, like looking really deeply at everything to the true root cause, and then trying to address those things. It just makes so much more sense than covering anything up. And I feel like in allopathic medicine, the way I was trained, you just spend years learning how to cover things up. There's very few allopathic medicine that actually, like, there are certain things that we can't do out, right? Like you break a bone, you may need surgery, right?
Yeah.
You a tumor that is growing control, you may need to have that removed, right? But there are other things like ovarian cysts don't necessarily have to be surgically removed. Like you can give the right hormones and that may on its own without having a surgery. So there's so many things that are just ridiculous, like reverse thyroid nodules. You can, there's so many things, and it's so beautiful.
So what made you, what was the turning point that you just chose to enter the natural side of things? Because like you said, you know, dig deeper, and then from there you can talk about the unexplained infertility being a lie and why is it a lie?
So this all started when I mentioned to you, you know, my marriage broke down, and then to pay God back, I went outside of that abortion center to pray. So on that particular day, I encountered a bunch of people who had been out there for a long time. It was kind of crazy and miraculous that I ended up on that particular day at that particular place. because the patriarch of the pro-life community, a man named John Stanton, who has set up so much for pro-life community in Philadelphia. Like, he started the pro-life union. He started 2 women's homes. He had 13 kids of his own, but he would constantly house mothers and their babies in his house with family. He would constantly be driving back and forth from Philly to Harrisburg to like fight and help to create laws that are pro-life and all sorts of. He was in every aspect of it. This was an ardent Catholic, and every day at Mass, he would go to daily Mass, and he would pray, asking God to please send a pro-life OBGYN to start what he called a Gianna Center. Gianna Center was like a NAPER technology type office. Mm-hmm. And he had been praying for this for a really long time. And he had even, at that time, I was working at a Catholic hospital as a gynecologist, but most gynecologists at Catholic hospitals aren't practicing in accordance with the Catholic faith, right? They're all writing contraceptives, they're all placing IUDs, they're not doing our abortions. And so he, and not doing tubules either, I guess. He had actually even come to my hospital and had spoken to administration and been like, this is a Catholic hospital. Why don't you have a NAPER trained physician here? And they were searching for someone to send for this training. And they were trying to convince a guy down the hall in my office to do this. I never knew it. And so the textbook for NAPER technology was sitting in my office manager's office, 6 feet away from me for about a year. And I had no idea. And so when I went and prayed outside this abortion center, this guy had died the night before, and I showed up the next day. And so all of his kids had shown up in place outside of the abortion center that day. And his eldest son, who kind of really fell in and filled his boots and started doing what he was doing, took over the pregnancy centers, was on the board of the pro-life union, all of that stuff. That guy, when he met me, he's like, who are you and what do you do? And I said, I'm a pro-life OBGYN. And he was like, oh, my pop sent you. And I was like, I'm sorry, I don't know who your pop is. And then I go to read about this guy, and I'm like, wow, okay. I had never before referred to myself as a pro-life OBGYN, like that was the first time I had really stepped out. I always considered myself to be pro-life, but I was like pro-life, but, like I was one of those people who was like, okay, in case of rape and incest, maybe, but I really didn't know what the heck I was talking about at that time. And so the next day he dropped off a book at my office about NAPER technology. And when I read that book, I was like, oh my gosh, I can actually practice medicine without using contraceptives. Like, this is amazing, because I knew it was against the faith. I knew that I wanted to practice in alignment with my faith. So I went to the drug cupboard and I pulled out every box of contraceptives and I read every mechanism of action on every one of those boxes. And I was like, oh my gosh, each and every one of these hormonal contraceptives is a possible abortifacient, because they thin the inner lining of the uterus and they prevent the embryo from implanting. It's not that they necessarily prevent the embryo from being formed. And the IUDs do the same thing. They make the inner lining of the uterus inhospitable so that the embryo can't implant there. And for the first time, I was like, I can't write anymore. Okay, what do I do next? Okay, I guess I'll see if I can do this NAPRO thing. So then I looked into it, and training was literally just a couple of months away. So I called them and I'm like, I need to come and get trained by you guys. And the hospital was like, we've been looking for someone for like the past year to send. And my office manager's like, here's textbook. And I'm like, okay, I guess this is what I need to do. And that was really, once I opened the door to looking at natural family planning, that was the beginning of me saying, wow, this is like completely different from anything I learned as a gynecologist, as an OBGYN in allopathic training. What else is there? What else have I not learned? And so I started looking at what are the integrative doctors doing? What are the functional medicine doctors doing? How are they looking at these things differently? And I started realizing the lab ranges that we have on our typical LabCorp and Quest things, those aren't optimal ranges. Those are just the ranges of the last 100 people who have come in and have that test, the upper level and the lower level. That doesn't mean anything about what is really good.
Yeah.
You know, like, it's ridiculous. So there's just so much that I learned just through reading and talking to other people and investigating, you know, what really is the root cause of all of these things and how can we address it and how can we help people heal. And it's been so refreshing every day. I know so many OBGYNs who get completely burnt out because it's completely boring to practice as a physician and just write prescriptions for medicines that are going to cause a million other side effects every single day.
Yep.
And it's like, oh, you have high blood pressure? Let me write this. Oh, now you have this because of the high blood pressure medication? Let me write this. It's like, it's a never ending. All you do is spend time, and you're seeing, like, the insurance companies want you to see at least 30 patients a day. So you don't have time to talk to people to really understand who they are, what's going on in their lives.
So that right there, you're saying something important. I was literally listening to a video yesterday of you. I don't know where it was, but you were talking about the importance of not rushing and having patience and getting to know them. What are the symptoms versus just like what you just said? Oh yeah, I have an appointment at 4 p.m. They're gonna come in, but you also know you have an appointment at 4:30. So let me just, write something and then they can go. Like, talk to me about how important that is, because I mean, I worked in a hospital like 18 years ago. I was a patient transporter, but I know that in the medical field, it's such a high demand. It's such a high demand. But how do you navigate that? Because,
So
like you
number
said,
one, I own my own office. So I get to dictate how long I spend with patients. And number two, I have realized the most important aspect of treating a patient is to actually ask them the right questions so that you can understand what's truly going on. Like, what really are their symptoms that they're trying to address? And so I made a decision early on when I began my practice that I wanted half-hour appointments. And it's really weird because in a typical medical practice, the longest appointment that you probably have is like 10 to 15 minutes. 20 minutes is super generous. But typically people are running behind because patients get late or it takes a while to check in. And by the time they're checked in, like, they're halfway through that appointment time and then everything gets shifted. So doctors are just running and running and running. So I will do things now, like of recent especially, I'm really trying to protect that time. So I will, if a patient's running late, I will call them to their car and I'll be like, okay, let's start the appointment. You're in your car. Let me get your information in the chart so that it's not that you're coming in and we have 5 minutes to talk. Like, I need these questions answered. Or I'll have my girls call them the chart so that we can get basic information in. So I'm not wasting time finding out what medications you're on. Like, that's already there. So I've already seen it when I have your chart. But that, it's so important to be able to talk to people. I don't like talking to people when they have their clothes off, like, to ask them personal questions. So, like, I will see the patient in my office at my desk, and then from there we will go to the exam room and I'll do whatever physical exam stuff we need to do. But you need time to be able to do that stuff.
yeah.
And so in order to do that, there are some insurance companies that will work with you and allow you to bill appropriately so that it makes sense to have a 30-minute appointment. And there are other insurance companies that won't. So for the longest time, my office was completely running in the red and I wasn't able to do it. Like, I was accepting every insurance, including Medicaid and Medicare, and they do not pay you to see patients for 30 minutes. They expect you to see a patient for 5 minutes and get them in and out. And so I had to make a really difficult decision to like drop every insurance except for two. And to make up for that, I did a membership program so that people could pay $75 a month and have, 4 visits for the year so that we still spend the time. And realized that even with that, there were some people who couldn't afford it because they were already, paying for insurance, and their company may not still reimburse them if they're going out of network, or they won't reimburse them enough. So then I created, at least God created, a bartering program. So if there are patients that don't have the money, but like they have organic chickens or eggs, I will take, the equivalent for the appointment in their eggs, or they want to come and walk my dog, or, like there's so many things that I need help with that I would always have to pay for. And then, I'm happy to help people out in that way as well. So I really wanted my office because I really felt like practicing the way that I practice, it was more, everything is to honor him. It's every bit of it is, I see these are your people, and I want you to bless them through me. And I want to love on them in your name. And every aspect of it is for him. So it wouldn't make sense if I had this practice and I was able to offer all this cool stuff, but I had to exclude 90% of the population from accessing it. So this is how he worked it out, which is so fun.
That is so awesome. I'm gonna make sure I'm gonna send everybody from Pennsylvania to go to. That is so cool. You remind me. So my kid pediatrician. So we used to have a different doctor before for them, and it was like you said, the 5, 10, 15 minutes, whatnot, and we switched over because one of our friends told us about that doctor, the pediatrician, and this pediatrician, she is so amazing. She's from India, and she is so sweet. She has her own, office. Well, she shares an office with another doctor. But the first time we went, and we literally was there for like an hour. Now, I'm not a person to be going to the doctor like that, so I'm like, oh my goodness, I don't want to keep doing this. Going to the doctor and stay there for 45 minutes. But then I started to realize, you know what? I am starting to appreciate this because what doctor does this? So every time my
Yeah.
kids go to a doctor's appointment, we're there for like 45 minutes. She's just getting to know us, talking to us. Sometimes my wife, if she has a concern, she'll text her at 9 o'clock in the night, and she does not care. She's like, just text me, and if I have I'll give you an answer or whatnot. And we have that communication. This is awesome. Like,
Yeah,
does
it's
that, you know?
the difference between a doctor who is doing this purely for the financial gain versus a doctor who's doing this because that's the mission that God's placed on their heart.
Right.
Yeah.
That is awesome. So I praise God for people like you, and keep doing that because people will appreciate that so much more than the typical traditional, allopathic way. So I do want to bring it back to the abortion because I do have a few questions, and which is very sensitive as well. So do
Don't
you
forget,
know?
don't forget the unexplained infertility part, though.
Oh
So I know
yes. Go ahead. You see, go ahead. Talk about that unexplained infertility. What is that, and why do you call it? Why do you say that unexplained infertility is a lie?
Okay, so unexplained infertility is a term used by infertility doctors, reproductive endocrinologists, when they have done their cursory workup and they have not found anything on that workup that explains why this person is not conceiving. But in my experience, there has never been a patient that I have encountered who doesn't have at least 3 things that are normal, which could be contributing towards difficulties conceiving. So I believe that oftentimes, unfortunately, I don't believe that those reproductive endocrinologists are mean people or bad doctors or anything like that. It's just the way that they've been trained. And they're not trained to look at the root causes. They're not trained to look. They have a very cookie cutter list of this lab, this lab, this lab, this lab. They never check blood work for the husband. They're only checking like a semen analysis. And even with the semen analysis, only looking at it in terms of IVF. So if a man has a semen analysis and he has very low sperm count and very low motility and very low concentration, they're going to say it's normal because they only need a few sperm out of that semen analysis. So they've actually changed it so that IVF way of looking at semen analysis is across the board how it is discussed, which is ridiculous. So when we look at a semen analysis, we look at it with the eyes of natural fertility, whereas like they'll not ever cut it for anybody. Their normals are not normal. So I would always say, number one, both the husband deserve a workup, because like thyroid dysfunction, insulin resistance, weight, all sorts of things, medications that you're taking, they can all impact the quality of your sperm and the quality of your ovulation, the quality of your eggs. When you look at a woman's bleeding patterns and, length of cycle, and do they have adequate estrogen and progesterone? I mean, there are just so many aspects to this that can be improved upon very easily. And I've just never, ever, ever encountered a woman who deals with infertility that does not have at least 3 things going on that we can begin to address. So I think that whole terminology is a complete lie.
Yeah. And why no to IVF?
Oh, that's a good one. So IVF, what happens with IVF is, number one, they will have the woman take a whole bunch of medications so that she will hyperstimulate her ovaries and create a whole bunch of eggs that they go in to retrieve, right? And so that medication in and of itself is not good for the woman. Then they will give a man a stack of pornography and tell him to go into the bathroom and create a sample for them. So in accordance with our faith, we want a guy masturbating. We don't want a guy using pornography. Like, all of those things straight off the bat are not good for this husband and wife. Then they clean that sperm, they put it together with these eggs that they've retrieved, and they see if any embryos are found. So say they have 6 embryos, right? They can't place all of those 6 embryos into the mother's womb at once. So it placed 2 of those embryos in the mother's womb. So what they do is they grade all of these embryos, and they say, okay, this is that grade. These are better. These ones we should discard. So straight off the bat, you're already losing children because each one of those embryos are your children.
Yeah.
So you're throwing away some of the embryos that are of poorer quality. Then they may put those first 2 or the best 2 in a fresh cycle, and the rest of them now you have to freeze. So you're paying for the freezing of embryos. And then in the next cycle or whenever, you can take some of those embryos out and place those in the next cycle. So it's the 2 embryos in that first cycle, and those 2 embryos take off like gangbusters, and then say 1 splits off into twins or 2 split off into twins. And now you have 3 or 4 babies in there. Then the next thing they say is, hey, this is now a dangerous pregnancy. You should really reduce. Otherwise, you're going to end up with premature deliveries, babies with mental retardation and mental deficiencies and problems with their eyes and development, and they'll end up NICU. So for the sake of the pregnancy, allow us to reduce, which means let us stick a needle into hearts that are already beating, and let us kill them and let them dissolve so that the other ones have a better shot.
Wow.
So that's abortion right there. And so you're doing this now. You have 6 embryos. So every cycle you go through, you may have to face these same questions. And it's just so much. It's way too much people to have to deal with. It's not. When you do NAPR technology, it's so rare that you'll end up with a twin pregnancy. It's typically a singleton pregnancy, which is a much safer pregnancy. You're not being exposed to all these chemicals. Cost of NAPR technology is like minuscule in comparison. A round of IVF is at least $3,000. People are mortgaging their homes to pay for IVF.
Wow.
versus like NAPR technology, what an office visit with someone like me, like $275. Medications, maybe like another $100, like a
Mhm.
follicular ultrasound series for the entire cycle, maybe $600. Like there's
Mhm.
no comparison between $3,000 to $9,000 a month versus what you're doing, in an April office.
Right. Yeah. That's, and I think you can speak into that. I think all of that is because, and what you're doing with the Naples technology or whatever, it's not something that they want out there. So people
No,
automatically gonna
no.
want to go to the IVF. They want the easy way out. They want all of that because that's where the money is going. You know.
And I think part of it is number one, physicians aren't educated on this, right? So every physician, when they think of infertility, they're like, oh, you need to go to the IVF. And the IVF doctors, they'll be like, okay, first we'll just do the workup and we'll see if we can just give you some Clomid and do an IUI or whatever. IUI, when they once again have the guy, use the
Mhm.
pornography, masturbate, blah, 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 inject it into the woman and then see if a pregnancy occurs. But their goal is always to get you to IVF because that's where they make their money. That's always the breadwinner for them.
Mhm.
So
Wow. Interesting. Interesting. Thank you for answering that. Um, so I do want to bring it back to more into the deeper topic of abortion. Talk about rape and incest and all of that. So, do you know who that Dr. Anthony Levantino is?
yes, I do know Anthony Levantino. Yeah, absolutely.
So I was been watching a lot of again Light Rose recent videos of former abortionists, but talking with other women who aborted their child in the past, and just beautiful, sad but beautiful conversation at the same time. And Dr. Levantino, he said that he performed over 1,200 first and second trimester abortions early in his career, and this was back in like the 70s and 80s. And he said only one was for rape, two for incest, and nine or 10 were for kids with Down syndrome, and all the rest were just healthy moms and healthy babies.
Yes,
Now, can you talk to me about abortion when it comes to rape and incest? The reason why I bring that up is because it's a very sensitive topic. It's even for people like us that are pro-life. It's tough to think about a 12-year-old girl getting raped and having her
hmm,
have a baby. You know what I'm saying? It's
yeah,
like, and I think about it for myself. I mean, I have a 5-month-old daughter, and I'm like, that's tough. But I'm still gonna stay strong to my conviction. But there are resources. There are a lot of other things out there that they're not telling you. So they're always gonna go to have an abortion, right?
absolutely.
The reason why I mentioned this is because just 3 weeks ago, I had a woman on my channel named Angela Harders, and she was a victim of rape 10 years ago, got pregnant, but she chose life. Even though she was pro life and she was a believer of the Lord, she struggled with it because of the real, emotion that she was going through. Like, never had that experience, but ultimately she chose life. And her father worked, I think, at a facility for pro life, that pro life movement, and he offered to adopt her child if
Hmm.
he said, like, listen, you don't have to take care of your child. I can adopt it for you. And unfortunately he did die a few years after, so she wound up having the baby, when the girl's 10 years old, and it's just amazing at how she chose life, and it was beautiful. Now what she said was that when she called the second time to Planned Parenthood, the person who spoke on the phone was the first time that spoke to her the first time she called, and she pretty much said, "Listen, um, we can take care of this right away. Nobody needs to know. And I know that you said that you want to be a missionary in other countries, this and that. If you were to have a baby, you'll never be able to accomplish all those goals." And that I was so frustrated when she told me that, but they didn't offer any other options except for terminate your baby. No one needs to know. I can do this for you. So talk to us about this whole rape. And it's a very small percentage, I know that. But talk to us about that. You know, a
Yeah.
12-year-old girl is raped and pregnant. What now?
So one of my dear friends, Kathy Barnett, I don't know if you've ever heard of her. She has a book out as well. And she ran for Congress. When Kathy's mom was 12, 11, very young, and she was raped by somebody in her family. And her grandmother stood up and said, no, we're not going to have an abortion. And she delivered Kathy, and Kathy was based as her sister. And now Kathy is taking care of her mom. And Kathy was a Fox News correspondent. She was very involved with politics. Kathy never shared her story until one day we had a conversation, and I think it was, I can't remember exactly what it was. There was something that had happened in Philly. I think it was when that representative came and all the people outside of the abortion center, he was like yelling at us, and then he quit. And there was a big to-do outside of that abortion center, and all these speakers came and everything. And then she reached out to me and she was like, I need my story with you and let you know. And then she told me that she was. The thing about rape is that rape is one of the most evil, right? Somebody is taking advantage of another to a 10-year-old, 11-year-old, a 12-year-old, a 13-year-old. It's despicable. And the perpetrator prosecuted to the law. But in the extent of the law, that persecutor is not dealt. Is an innocent child who is conceived is given horrible treatment that the child is dismembered because of the sins of its father. Why is that? And the other thing is, a woman who has been raped is completely traumatized. So why do we think that having that woman then be responsible for ending the life of her child? How can we think that that is going to be less traumatizing, that is going to solve something? Because now somebody has inflicted a great injustice upon her, and then we're telling her that she must now choose a grave injustice upon her own flesh and blood.
Right.
I know so many women beautiful, strong women, who they were raped. There's one of my really good friends. She was raped, and then she conceived her son. And then, actually, no, it goes farther back. Her mother was raped and conceived her.
Wow.
And then she was gang raped, and she conceived her son.
Wow.
And so if either of those women had not had the strength to stand up and choose life, that little boy would not be there. And then she went on to marry an amazing man who adopted the son, and now together they have another child. And so that entire family would not be present. And she's a mountain mover. Like, this woman has so much love for the Lord, and she does so much. And she's an amazing person. Ryan Baumberger from the Radiance Foundation, he was conceived in rape. So whenever I encounter somebody who's been adopted, I tell them, I'm like, oh my gosh, you're so blessed. You are doubly loved. You are loved so much by your birth mother that she chose not to abort you. She chose to give you life. And now you have been adopted by this family who loves you so much that they're sacrificing for you, and they wanted you and prayed for you so much. So these children, they can be raised by the mother, or they can be raised in an open adoption, or they can be raised in there's so many options. And they have done studies of how do women do when they choose abortion versus they choose adoption. The women who choose adoption do way better because they're not traumatized doubly. So that's my case when it comes to incest and rape. I don't believe that either obviously are good things. And in an ideal world, we would be able to protect all of these women from all of these things. But evil exists, and there are people who will pray. But I don't believe that ending the life of an innocent child remedies the situation.
Right. I stand with you as well. So speaking about the effects of abortion, I want you to talk about that. But before you even mention that, so because I have a few people that message me, and because they saw that you were going to be on my channel and they had questions and whatnot. So I know somebody who unfortunately had been sex trafficked in her adult years for quite quite a few years, and unfortunately she had multiple forced abortions.
Yeah.
It was at death threats, saying that if you don't go ahead with this, you're gonna get raped and beaten and this and that. And I mean, like, yes, it was wrong that she aborted, but I'm not gonna be mad at her, because of the fear
Yeah.
of, what I'm saying. It's like, whoa, what do you
So
do
this is
then?
the thing, like when someone has an abortion, our response towards that woman is not one of anger.
Right.
Our response towards that woman is one of pity, because she has made this choice, a choice that she will likely have to live with for the rest of her life. And I have encountered so many women who have chosen abortion in much different circumstances as
Mhm.
well, that they still have nightmares. They can't go to the dentist because the sound of that drill is the same. The sound of the suction, the drill, all of that stuff is very similar to the sounds that they experience that day. And so they get PTSD from it.
Mm.
In her case, I mean, obviously she felt like she couldn't get out of that human trafficking scenario. She couldn't survive herself, is literally just trying to survive. And I understand the fear. All abortions are based on fear.
Mhm.
Women don't choose abortion because it's the fun thing to do. They might like go in there laughing and act like it's not a big deal, but every single one of them are choosing to end the life of their child because they have fear that they don't have the financial resources. They don't have community to support. They don't have the ability to fulfill their dreams. They don't have, whatever. It's like a bunch of, you can't do this unless you do this.
Right.
You will never be able to achieve your dreams unless you have an abortion. And it's all a bunch of lies. And
Mhm.
it's perpetrated by the abortion industry because that's how they make their money. They are those women who talk to them on the phone, like you mentioned, they are trained to sell abortions like they sell used cars.
Hmm.
They win like pizza parties if they hit their quotas of abortions a month. Like, this is a thing. They are salespeople for abortion. And their
Yeah.
job is to talk every person who comes in into having an abortion because that's where their money comes from.
Yeah.
So my response to any woman who has had an abortion is, do you realize that there are healing sources out there? And every woman who comes into my office who has a history of abortion, I always take the time to offer those healing resources and to let them know their baby is in, and that their baby does not have hatred towards them. Their baby loves them. Their baby wants them to be able to receive the healing through Christ so that one day they can be reunited.
Amen.
And it's all about, in order to be one with Christ, we have to be willing to fess up to every choice that we made and to apologize for those that have not been in alignment with his teaching. And so it's hard for some women, but that healing is absolutely available. It's available to anybody, not only women who have had abortions, people who have taken someone for an abortion, people who have paid for an abortion, people who have lost siblings because of abortion. That healing is available for. I've never met a person in my life who has not been in some way impacted by abortion. Someone they know has had an abortion, they have had an abortion, they've paid for an abortion, they talked to someone about an abortion. It's in everyone's life.
Right. And then, of course, there are a bunch of effects because of, abortion, whether it's physical, spiritual, emotional, all of that. And unfortunately, the person that I was telling you about, because of those forced abortions, she has health issues dealing with stage 4 endometriosis and, just going through a lot, but still being a warrior that she is and fighting against human trafficking as a survivor and speaking up for the voiceless and whatnot, So I can only imagine all the internal, or the effects that someone is going through because of the abortions.
Yeah. I mean, abortion, definitely, there are ties to multiple abortions leading to increased risk of breast cancer, for sure. There are ties with, abortions physically causing damage to the cervix, so making it harder possibly to carry a pregnancy down the road when you want. There's, possibilities of scarring of the uterine lining and things like that, or perforating the uterus and causing bleeding at the time, or sepsis. There are women who have died for complications to abortions.
Yeah.
So it's not a cut and dry, easy procedure, especially as the baby gets older and they're spending more money to do this.
Right. So I want to talk about this last thing. And there was a picture that I posted that was shared from, I think, Lila Rose's chat, Instagram, and it was a picture of you. And you said, well, in a statement, because you both of you spoke about this as well, that it is never medically necessary to have an abortion. So I posted the picture, and unfortunately, I got quote unquote fact checked, so they blurred my photo or that photo, and on Facebook too. But that is a big deal. That's a big statement because a lot of people will be like, "That's impossible." I know people that this and that, and they couldn't, survive, or if the abortion didn't happen. Like, can you talk to us about that? I mean,
Yeah, it's exactly what I was mentioning at the beginning of our talk. There is a difference between delivering a baby early and having an abortion. So just because when a woman has any sort of medical problem, that becomes a high risk pregnancy. And there are specific doctors who are trained to manage high risk pregnancies. They do more intensive monitoring, they watch the mother, and many women with severe hypertension, severe thyroid dysfunction, diabetes, heart conditions, all sorts of women have babies. And oftentimes they can get that baby far enough along that the baby can still. So like if you get a baby all the way to 21, 22, 23, 24 weeks, yes, that baby may have problems on the outside afterwards, but there's a good chance that they can help that baby to survive, right? So when women say this one had a medical issue, like this one had cancer, and so she had to have an abortion. No, they're actually, it's interesting. I'm not a huge fan of chemotherapy to start off with, right? There's lots of natural treatments you can use for cancer outside of chemotherapy that can address cancer. But that being said, there are also chemotherapies for certain types of cancers that don't even kill the baby. And so the baby can survive despite the chemotherapy. Yeah. So it all depends on the situation. But even if there was a woman who had a baby and she was told that this chemotherapy that she had decided to take was going to kill this child, she could decide to deliver early. And in delivering early, she could then hold that child, allow that child to be in her arms, allow that child to be mourned, allow photographs to be taken of that child, allow that child to be honored and buried and everything else. And that is different from an abortion where they are injecting this baby's heart, giving it a heart attack, dismembering it, and then throwing it. That's completely different. You can take a pregnancy as far as possible until it becomes to the point where it is unsafe. And at that point, you make the decision, okay, now we have to deliver. We've tried everything we possibly could. We've looked outside of the box and we've done everything we could to get this baby as far along as possible. And sometimes those babies miraculously will make it and sometimes they will not. But there's a huge difference between dismembering a baby and throwing it in the trash and delivering it early.
Right. Yeah. That's so true. And you and I believe, and unfortunately not everybody or physician has that. Like, we serve a God of miracles.
Miracles. A God who raises people from the dead. Like,
right. Even if that baby does not survive, that does not mean that God was weak or anything. No. But the fact that we allow God to make the final say if that baby's gonna live or not, let it be God and not the physician's hands.
Yes. Exactly. Like, we are not intentionally killing this child.
Right. That is, man. It's so, so deep. We can go deeper and deeper in this topic.
But it all makes sense, right? I mean, it makes so much sense. The truth always makes sense.
Of course. And I love how Ben Shapiro always says that the truth does not care about your feelings. Now, he's not trying to say that your feelings doesn't matter, but the truth is the truth. Because you can feel this and feel that, but okay, I understand that you may feel a certain way, but let's go down to what the truth is. And again, it has to start from God's word.
That's the problem. I think a lot of people have this false notion that the truth is variable, that the truth is different for different people, and that's your truth and my truth, and well, that's true for me, but not for you. And there is only one truth.
Exactly.
Otherwise, it wouldn't be true.
Exactly. Exactly. So I just want to say thank you so much for coming on, for taking your time. And you don't know who I was when I messaged you, but you wrote back, and I'm just happy that we were able to have this conversation, especially just 2 days before the election. And it's funny because when we spoke about the date, I didn't even realize that the election day was November 5th until a week after. But it was perfect timing, and I honor you. I praise God for you that you continue doing the work that you do. Obviously, you're more educated than I am in this area. I'm learning as I go, but I'm also, as we spoke offline, I'm very big into the anti-human trafficking, and I believe, and I made a statement on my social media recently, that I believe that abortion is the number one crime in the world for humans inside the womb, while sex trafficking or human trafficking is the number one crime in the world for humans outside of the womb. And that is why, for me, and both the unborn and those that are sex trafficked, labor trafficked, or human trafficking in general, both of them are voiceless.
Absolutely.
One of them can speak, but they're scared, so they won't. So they become voiceless. Both sides are voiceless. So I'm gonna be a voice for those who are trafficked and that cannot do anything with through education and whatnot.
Yeah, and I think there's so much education that needs to happen. And very recently, there's an amazing documentary that was done in like 2013, 2014, and it's called Maafa 21. And so people who are promoting abortion are using this race card, and they are trying to act like abortion is something especially the African American population needs. But if anybody watches this amazing documentary that is free, available on YouTube, Maafa 21,
Mhm.
Maafa 21. It is the most revealing, amazing documentary, and it speaks so much truth about how racism in this country is absolutely a true thing. And
Mhm.
it started, at the beginning of time when, slaves were from Africa. But even when everything stopped as far as the slave trade and everything else, it continued. But the most recent attack on the African American race is abortion. And contraceptives and abortion were 100% targeted. And they have so many facts in there that show the people who were promoting it at the very beginning were Margaret Sanger and the people who were with eugenics. And they have documented over and over and over that their purpose for contraceptives and abortion was to end the African American race.
Yep.
And abortion does that. Every day when I stand outside of Planned Parenthood, I count the number of African American women who are going in there to kill their babies. 90% of going in on a Saturday morning in downtown Philadelphia are Black.
Wow.
And killing the future generations of the
Mhm.
African American people. And
Yep.
anybody, it's so ridiculous because they have signs on their window that says Black Lives Matter, but those Black lives are all in the mesh. And
Right.
it's a ridiculous thing, and people are so blind to this. But abortion is killing the African American, the lower socioeconomic classes.
Mhm.
It
Yeah.
is absolutely putting a dent in. It's killed more people in this world than any other medical illness. It's
Wow.
killed more people than were killed in the Vietnam War. It's
Hmm.
killed more people. Like it's the greatest killer of our time,
Yeah.
abortion.
That's unfortunate. I want to end with this story. It's a sad story, but it has a happy overturn throughout the years. 2 weeks ago or 3 weeks ago, we had a Walk for Freedom event for human trafficking. I don't know if you've heard of A21.
Hmm.
A21 is probably one of the biggest organizations in the world where they focus on human trafficking education, prevention, and they do walks every year. I'm talking about in so many different countries, including here in America and many states. And here, it happened on October 19th in Miami, and then one in Fort Lauderdale. Same day, same time. But I went to the one in Miami, and one of the speakers who mentioned that this is seventh year in this walk, she started off in South Carolina, one of the Carolinas, and she mentioned how her and her team received a call of a case of an 18-month-old baby girl who was sex trafficked.
Oh my God.
And they had to do so many different surgeries on this baby because of that. But through the grace of God, I don't know how old she is now. I don't know what year this happened, but through the grace of God, she's fine. They've been walking with her in this life and, healing and all that kind of stuff. But just thinking about that 18-month-old girl baby girl raped this, and it's just so much. And they had to do multiple surgeries on this baby.
Have you seen
That's
Sound of
why,
Freedom?
yes, I saw The Sound of Freedom.
Yeah.
I saw The Sound of Freedom. The next, what movie was good, that you need to see too? City of Dreams. It
Mm.
came out. It's on Amazon Prime. I think they rent it for $10. But it's also this one specifically on labor trafficking. Man, it was a hard movie to watch as well. Of a little, I think it was like a 7-year-old Mexican boy who goes to America because he wants to join this soccer league. That's his dream. But and he had to work, but it was all labor trafficking, and then how he escaped. It was rough to watch. Actually, the people that made that film, one of them were actually at the event that I was at, and they were talking about it and whatnot. So yeah, so all of that just to say that, me and you are fighting for the same cause, for the voiceless, whether it's abortion, whether it's kids or even adults that are being human trafficked. So I really hope that what that story that I just shared, that people listen to it, they can really like wake them up and be like, I cannot stay quiet. I need to educate myself on this stuff because it's happening every day, right in front of our
Everywhere,
eyes.
in
Every
every city, in
Yes,
every
every
neighborhood.
city in America, human trafficking exists. And Miami, where I live, South Florida, Miami is number one in Florida, while Florida, as far as state, is number three in the whole country. So it's happening everywhere. I mean, I know multiple survivors. I actually interviewed the other day, last Saturday, a survivor that I met a few months ago, and she came over and met my wife, and we did a pre-recorded, so it's gonna come out tomorrow, the video, and she shared her story of how she was trafficked in California. She's from Brazil. She was just traveling the world at one time, and COVID came, and she was stuck in this country in quarantine, and she got trafficked, and she just shares a story, So, and this was 4 years ago, 4 years ago,
Yeah.
So it's all there. I just pray that we become more educated on these two topics, abortion and human trafficking, so we can stand up for the truth and stand up for the voices, just like me and you are doing. So, Dr. Monique, I appreciate you for coming on. You have been great. I learned a lot from you, and I'm still going to continue looking into your stuff because there's a lot of things that need to be spread out and more people need to know, among other people like Lila Rose and former abortionists and whatnot. So, any final words would you like to share or say to anybody?
Just be brave. Know that we know what the end of the story is. We know that Christ wins and that our goal here on this planet is simply to do his work. And it takes a lot of courage. At times, it takes a willingness to stand up and speak the truth, even when it's not popular. But at the end of the day, when you have to face Jesus, it's going to be so worth it. And he will provide you with so much peace and so much courage and so much grace and so much protection, and just seek the joy every day, because we're not promised anything more than right now, this moment. That's all we got. So
Amen.
make every choice that you can to just honor
Amen.
him and do his work. Yeah.
Amen. And if anybody wants to know more about where they can find her, her website is naturalwomenshealth.com. And if you could go on her IG, which is her name, just with dots in between her name, and you can find her and see what she does. She's also on YouTube. She's also on TikTok. I've been binge watching some of her videos on relationship advice, and I'm like, this is so cool. So that
Share it
is
with all your kids. That'll be great. Yeah.
yeah. So my friends, thank you for listening. For those that will watch after this throughout the week or whenever, please like this video, share it, because there's a lot of nuggets, a lot of truth in this video, despite what society, despite what the enemy wants to tell everybody else. And we live for the truth, and there's only one truth. All right, my friends, I'm gonna put you backstage for a second. Um, have a great Sunday. Have a great rest of the week, and stay strong with this crazy days coming up with the election. Don't get out of hand. I know our emotions all over the place, but just remember that God, whoever becomes president, Kamala or Trump, God is still sovereign. The Bible says that He puts down kings and He puts up kings and He puts down kings. It doesn't matter. Now, that does not mean that we are passive and we just stay behind and let everything happen. No, we play a part and we see what God does. But know that He is sovereign above all things. Nothing happens outside of His hands. He knows exactly what's going to happen, and He's in control. So have faith in the Lord and trust Him with everything that you have. Have a great Sunday. Have a great night. And I am going to end here. Love you guys.